Hi Erika. So after taking a look at your symptoms, we have diagnosed you with gastroesophageal reflux disease, or GERD, and many of the symptoms commonly associated with GERD you have presented with, such as chest pain, heartburn, shortness of breath, coughing. All of that can be attributed to GERD. And sometimes the chest pain from this condition can be painful enough that it seems like a heart attack, but that is not what you are experiencing. So this alone is not a terribly serious condition. However, if it's left untreated, it can lead to esophageal strictures, Barrett's esophagus, which is a precancerous condition, and an esophageal ulcer from stomach acid. However, since we seem to have caught it in time, you should be just fine. We'll double check our diagnosis through a barium swallow test, where you'll swallow a liquid that contains barium, and we will use an X-ray to get an image of your esophagus as you swallow, which will help to confirm our diagnosis. And this test is not at all harmful to your baby. We could also use an esophageal motility test or an endoscopy if we wanted to get a sample of tissue from your esophagus in order to double check for Barrett's esophagus. And again, none of these are harmful to the fetus. And for treatment, we would start off with over-the-counter meds such as antacids, H2 receptor blockers, or proton pump inhibitors, and the last two in particular are to not only decrease acid production from the stomach, but that way it'll give the lining of the esophagus, time to heal. And so essentially, this condition that you're experiencing, your lower esophageal sphincter does not work correctly. It's allowing some of the acid from the stomach to rise back up into the esophagus, which does not have the same lining as the stomach to protect it from the acid, which is causing the pain. And so the H2 receptor blockers and the proton pump inhibitors are both completely safe for your fetus. The antacids, however, some of them have either not yet been tested or they may have adverse effects on your fetus, so I would recommend staying away from those unless we feel that we have to turn to them. Now, if the over-the-counter meds don't work, then we would turn to prescription strengths of those same medications. And this is extremely unlikely. However, if none of these options pans out, then surgery would be our next choice, and we have two main options for that, which would either be a Lynx device, which is a ring of magnets that goes around your lower esophageal sphincter, and the strength of the magnets, they're strong enough that they hold the sphincter closed. However, they're weak enough that they'll open when food or drink is going down your esophagus. And our other option is a Nissen fundoplication, which is a tightening of the lower esophageal sphincter to keep the acid in the stomach. So hopefully with the proper medication, you should feel relief from this condition in hopefully a few weeks, if not longer. If you feel any more severe chest pain or anything like that, you should come back in. Otherwise, if the meds are working, hopefully we won't see you again, or not past your follow-up anyway, and we will go from there.